Okay, welcome back to Open, with studies showing a strong link between excessive screen time and the rising rates of anxiety and depression among teens. Concerns over social media's impact on young minds continue to grow. In response, policymakers and educators are pushing for measures to limit distractions in schools, while mental health professionals stress the importance of balance and healthy digital habits. Joining us is JCCA's program supervisor of the Westchester Day Treatment. It is Andrea Cimino. Thank you for joining us, Andrea.
Thank you for having me.
And the Assistant VP of Behavioral Health Wellness, Westchester. It is Beauty. I want to pronounce it right. Beauty Garcia Whitfield. Nice to have you both with us.
Thank you for having us.
Thank you.
Let's just talk about JCCA in general, just so people know what the framework that we're going to be talking about.
Of course, JCCA is one of the oldest non-for-profit organizations. We've been around for almost over 200 years.
Wow.
Yeah, we started
And I
off.
can't say, unlike the previous guest, I can't say that I was there the first day.
Yeah, no.
Not quite.
We started off as an orphanage. So when children were coming from Israel, they came over and we had an orphanage. And so then it expanded through the years and it immersed itself into a foster care agency. And then it continued to expand. And we provide school-based services, mental health services, and all behavioral health services across New York State in the continuum.
You know, I was just talking with you before about that I've been sitting in this seat for a long time and seeing what goes on in the Bronx. And frankly, you could see it on the program we've already done. The whole notion of families and supporting families and dealing with the whole picture of what goes on in families is vital. And I guess that's what you do. And I guess you recognize this grassroots concept of serving families.
Yes,
just talk a little bit
absolutely.
about the best of what you do that makes that work.
I think I've been with the organization almost 20 years, so I've held a position in almost every single division. So seeing the work and how it's evolved and the different families that we have and the children's, it's seeing the evolution of the workers that are coming into the field with this sense and this need to want to save and to help others
Well,
who
is that
are in
ever a
struggling
Bronx
communities.
concept if I've ever heard one? Go ahead, I'm sorry.
Absolutely. And so in looking at the parents, we've always had to kind of morph ourselves, even as clinicians, in the work that we do and how we approach culture, backgrounds, community, what's important to the family, so that we make sure that keeping children in their community but providing the services that's necessary is important, while also destigmatizing mental health.
Andrea, we introduced this by talking about the digital situation.
Yes.
Let's connect the dots between mental health and what is out there in social media, and especially young people. For 2 years, they sat and looked at screens.
Oh,
they didn't get to go out and be in school with other people.
Yeah.
Talk about the general look at the mental health of young people as regards this digital age.
Yeah, of course. Well, as you already alluded to, the pandemic definitely was a huge factor that contributed to more and more youth using social media. They already were using it. But I think it's really important to note that it's something where kiddos can get a fear of missing out, or FOMO as they call it. They'll look on their screens and they'll see, oh,
I've never heard that. Fear of missing out.
Fear of missing
FOMO.
out.
FOMO.
FOMO, yep. I gotta stay in touch with the youth's language. But, they see all of these exciting experiences on social media, right? Whether it's posted by influencers or people they know. And I think it can be so important to realize that social media is really just a highlight reel, right? We are just seeing the wonderful moments, the best days. No one's posting, crying in the shower. It's a rough, there's rough times that happen to people, but they don't always show it. And I think youth don't always realize that they're just seeing the good moments. Maybe they can think, oh, other people aren't going through these depressive feelings or these anxious feelings. Why don't I look like that? Why isn't my life like this? And it can be really difficult with comparisons.
You know what's interesting, and I was just thinking while you were talking, in previous days, before we had the internet and all these things, when you'd see commercials and everybody in the commercial was beautiful and looked a certain way, there was a lot of pressure on young people to be that.
Oh,
and of
yeah.
course,
Oh, yeah.
We're regular people. We can't all be this, that, or the other. But with social media, it's infinitely worse because everybody's got a phone that they've got in their hand and they can see it, and who knows what the images that come by, and then of course with a young person so impressionable.
Of course.
Is there a way to make this work as opposed to have it be a difficult problem?
Oh, yeah, absolutely. Because social media definitely, it's not all bad. It is a tool. It's a way that we can connect with others. It's a way where we can look and see, okay, this is what I want for myself. This is a way of achieving my goals. And I think just with everything, we need to utilize it in moderation. So there's a difference between I'm going to relax and scroll for a little bit versus I'm staying up all hours of the night. I'm just on TikTok, and next thing I know, the school
And then
alarm's
we're
going
sitting
off.
here and we're staring at our phone literally all day.
Exactly,
Yes.
exactly.
Yeah. That to me gets into parenting as much as it is with just trying to lecture a young person. Good luck with that, right? And
course,
so
yeah.
part of this message is really for parents as well.
Absolutely.
Well, what is the advice for parents?
So with parents, I think enforcing healthy limits for themselves as well to show their kiddos, listen, we're all doing this together. We all benefit from breaks on social media. Maybe taking time to eat dinner as a family, just half hour, we put the phones down. I know it's a crazy concept, at least at this day and
It
age.
used to not be crazy.
It used
be
to
the
not
way that we
be.
lived. That's
Exactly.
correct.
And we've definitely drifted farther from that. But I think leading by example is going to be such a helpful point.
Beauty, let's just talk about this whole notion of digital issues in the context of JCCA.
Yeah.
I guess you talked about 20 years. You've been there a long time. You've had to change, and JCCA has had to
Yes.
change to go with these kind of new issues.
Yeah.
Talk a little bit about, as an organization, how you have tried to deal with these things.
I think the evolution of everything with technology, right? Before we would pick up the phone and have more phone calls, more phone contact. Before we didn't have cell phones as an organization, right? You had to call someone at the desk phone, make sure you checked it, you checked your voicemail, and get back to them 24 hours later. So if you look at the voicemail notes, they would say, we can get back to you within 24 to 48 hours. Now everything is super accessible. And so that boundaries piece has kind of lost its essence because families can find you, providers can find you, your boss can find you, your staff can find you, everyone can find you even more accessible because you have an organizational phone. But now that expectation has been posed upon our clients. Because we're also accessible, we're expecting the families to also be accessible and not have those boundaries and when they want to have those conversations with us. It's the same thing as families texting us for information or to advise us of something.
And so you have put those systems in place.
Yeah, so everyone in the organization, of course, has a cell phone, so we are super reachable and accessible. But when we look at systems, we look at how we've evolved, even in our electronic health record, and how we're going to continue to evolve in our EHR. One conversation that we've been having as an organization, and there's an organization piloting a lot of non-for-profits to think about how AI comes in to the structure of having these things. Yeah.
I was just thinking of all the complications, and now you've just thrown another whole
I threw another
monkey
wrench to
in
you,
there.
of course, but
Yeah.
AI, that's a whole different, subdivision of a conversation. But the accessibility so that clients can feel that they are having a conversation with someone. Think about all of the different mental health organizations, the for-profit organizations that are now taking advantage of texting if you feel you are stressed, 988, etc. Having those conversations when you feel you need immediate gratification to talk to someone because you're feeling an urgent need.
So you
We've provided
have that opportunity.
So there's opportunities to connect with us on a 24/7 basis. Everyone is on call because we want to make sure that we're supporting our clients.
I'm going to get back to Andrea with this concept. This taps into something that I'm very particular as a communications professional.
Yeah.
I try to get in touch with people, and you mentioned that. That you're always available. A lot of people do this, and they put the phone down, and then all of a sudden they don't talk to you. And to me, so how do we get people to use these devices properly
Yes.
so that they really still do communicate? I mean, I
Yes.
deal with people, and in the old days, like you said, you picked up the phone, you called somebody, maybe you left a message, and they'd call you back.
Yeah.
Or if they were there, they'd call and they'd say, "Oh, okay, I'll be right back."
Sure.
Nowadays, it's gone.
Yeah.
How do we get people to really communicate in the framework of this so that all the other mental health issues at least get addressed.
Yeah, of course, of course. And I think an important thing to realize is that phone usage, social media, it's not going anywhere,
No.
right? Like, so we have to
Damn.
figure out, I know,
Damn.
darn.
It's gonna expand.
Sorry,
We have to
darn.
We have to figure out how to evolve alongside of it. And I think promoting different opportunities of face-to-face contact, right? Utilizing even video chats. That way kiddos are able to recognize some body language, because that's something that's been declining over recent years, recognizing different nonverbal cues, picking up body language, because when we're texting and typing on a screen,
Yes.
we're not reading the text messages body language.
How many of us have received a text and said, "Oh, I didn't really mean that," because you
Yes.
didn't
Oh,
hear
yeah.
how
Oh,
I said
yes.
it.
Oh, yeah.
So, what framework do you use? Do you have meetings? Do you work with people individually? How does that
All
work
of the
out?
above. Yes.
All of the above.
All of the above. You know, we meet for individual, we meet with groups, we meet with families as a whole. A lot of my clients have already come up to me with goals of wanting to detach from social media, wanting to spend less time on their
I'm
phones.
trying, folks.
You're trying. You're trying.
It's not working, but I am trying. Go
Well,
ahead.
listen, and I think the important thing to realize, it doesn't have to be these big drastic changes.
Yeah.
I have someone that I work with, and we try just 5 minutes a day. Put your phone down, set an alarm, do anything else. And gradually that 5 minutes became 10 minutes. It became 15 minutes.
You say you actually have somebody you did.
Yeah.
Yeah.
And keep going. 15 minutes.
15
and now where
minutes.
Are they at?
They're at 2 hours. They're at 2 hours at this
Wow.
point.
2
Yeah.
hours every day that they do not.
They disconnect,
And
yeah.
do you have a sense that they've been mentally healthier? Or?
I do. I've noticed an improvement in their self-care, and they have also seemed to be more observant of themselves, their own feelings, their emotions, their thoughts. They've been able to reflect more inward rather than deflecting and focusing on the screen.
Beauty, let's just conclude with people who want to be in touch, who want to learn more, and of course want to participate in this whole process, especially for parents who are like, what am I going to do with these kids?
Absolutely. As I said, JCCA has a continuum of services where we are happy to support anyone who qualifies for the services, to really support them in their mental health. And so you can reach us at www.jccany.org.
Both of you, thank you so much for
Of course. Thank you so
recognizing what's
much.
going on out there and working together to help our families. It's practically the theme of the show this morning. Anyway, thank you both for
Thank
joining
you.
us.
Thank
More
you.
information, once again, you can visit the website at jccany.org.